Hi, this is Dr. Wade Binley. I'm the founder and the clinic director of the IV Solutions Method. Health is and always will be our greatest priority as well as our greatest asset to living. But since this pandemic has hit us all, people are confused and afraid, and they feel out of control of their own health. Today, people are wanting to know if their health is failing and how to stop it. They want to know why and how, if they are vulnerable to chronic illness or infections before they happen. Finally, the current state health model is not designed to provide this kind of answer. It's a system that only offers and feeds the confusion. It does not offer solutions to your vulnerability, nor a resolution to the underlying cause or solution to your vulnerability. What it does is it only offers management to your symptomology. And this is critical right now. If you have these symptoms of this severe disease process, it may be too late. So you deserve to know why and how. You shouldn't have to guess on your health or not. You see, optimal health is far more than the absence of disease or symptomology. You must understand that the medical model is great, but it's not dedicated to health. It's dedicated to the diagnosis and management of disease, not to provide your greatest asset. So having said that, today I'd like to talk to you about functional medical testing dedicated to your immune system. There's 4 tests that I do recommend. One is a basic chemistry panel with a CBC and a blood smear in conjunction with other specific markers for your immune status. And the other 3 are called functional tests. And the reason why we do functional tests, what I need to know about you and your immune system is 3 things. I need to know your nutrient density, which we also call your organ reserve. Number 2, we need to know your digestive system function, because 70% of your immune system is wrapped around your colon. And the third test we need to know the activity of your nutritional density versus your toxic load and the elements of toxic load. So the first test we're going to talk about is called a Spectracell Micronutrient test. This is a blood draw, and what they do, it's a special test. There's only one lab in the entire country that does this. And what it does is it draws your blood and it cultures your immune cells. And what they do is they look inside your immune cells, and they evaluate 31 different elements, nutritional markers and vitamins and minerals, as well as other compounds that our body makes that are specific for your immune system. Once again, a T cell is your immune system, so they're diving deep right into the immune cell to see how strong it is. That is a great test. It's the only one in there. It doesn't just test for what's in your serum or other tests that let you know your density of your vitamins and minerals inside your cell. It goes beyond that and tests for the activity and the interrelationships of the nutrients, because this is a biological process. And the second test is called a comprehensive and digestive stool analysis. This is a stool test, and it tests, for the particular test that I do, is a 1-day stool test. It's testing for what's in your bowels, what kind of bugs are in your bowels, whether you have pathogenic bacteria, viruses, or parasites, whether you have H. pylori, and all these. It's a special test for H. pylori, which tests for all the virulence factors within there. It also tests for your healthy bacteria and your status of your healthy bacteria. It tests for your biodiversity, your diversity of your microbiome, which is extremely important when it comes to your health of your colon and your immune system, as well as it tests for commensal bacteria, which are the good guys, or which are considered opportunistic, but they can become bad. And then it also tests for protozoas and worms. The specific part of this test that's dedicated directly to your immune system is it looks at pancreatic function, which is a major immune gland, as well as its digestive capacity and secretions from the pancreas, as well as your immune function based on a secretion, an immune secretion called secretory IgA. It looks for something called fecal calprotectin, which tests for your immune function in regards to inflammation of your colon, and it tests for your status of your gut lining, which determines whether or not you have propensity towards leaky gut or you have a fulminant leaky gut condition, as well as another marker that is dedicated to recycling toxins. So all these markers are essential for your immune system. Now the third functional test is called an organic acid test, which is called an OAT test abbreviation. And this looks for a variety of different things. We look for, it's kind of like looking at your smog. It's like a smog test in your exhaust. We're looking at the chemical elements, 76 different chemical elements that are byproducts from your physiology based on different functions. Well, it studies and screens for the mold toxins, fungal toxins, elements of bacterial overgrowth, and other types of pathogenic bacteria, as well as knowing your nutrient status, how well your vitamins are being used in your body based on their potential to activate certain systems. And it tests for your overall ability to detoxify. Now, these are extremely, extremely important tests to have. So review, functional tests, Spectracell Micronutrients for nutrient density and or organ reserve, GI tests, comprehensive digestive and stool analysis for digestive function and immune function in the bowels, and 3, the OAT test, which is the overall physiological function test that lets us know that dimension between toxic load and nutritional status function. Having these tests performed will let you know your health status, especially as it dedicates, these tests are dedicated to your immune function. Now there's lots of other tests that can be run, but these 4 are my basic go-to tests for the immune function. And today we really want to know that. Patients want to know that. They don't want to stay confused. They don't want to be in fear. They want to know their health status. And this is one way that you can do that. I'm available for phone consultations. How to get our staff is, we're still working here. We're trying to get as much information we can out to patients so that they're not panicking about their health, because people are. And we want to be able to calm their nerves, give them some advice that's specific to them and information that's specific to them so that they can have confidence in their health and they can learn how to do the proper steps to build back their bodies and their immune system. I hope this has been helpful for you. This is Dr. Wade Binley. I'm a functional healthcare provider, and I've created a functional system called the IB Solutions Method. So I'd appreciate it if you could hit the bell down below and become a subscriber to my YouTube channel, and all the contact information is below as well so that you can contact our office. And we can drop ship these tests. We can do the OAT test, and we can do this digestive stool analysis by drop ship. We can also have a kit sent to you from Spectracell, and we can send a phlebotomist over to your house if you want to get started right away. I anticipate that there's going to be a lot of interest in knowing their person's health status, especially because people are confused and they're in fear about what it is now. But there is so much you can do and so much you can know about your bioindividuality with these types of tests that will help you get through this trying time that we're all subjected to. Thanks again for listening. This is Dr. Wade Binley.